Hi, my name is Zoe Greenhall, and this is my midterm presentation for my thesis project, Redesigning the Pelvic Exam. So for my thesis, I am redesigning the gown worn at the gynecologist to reduce anxiety and discomfort for patients during the pelvic examination. And why is this a problem? Because visiting the gynecologist for a yearly pelvic examination has been known to cause anxiety, pain, and discomfort for patients. And these feelings of distress have been determined as the main reasons for patient avoidance of the gynecologist, specifically for the pelvic exam. So what is a pelvic exam? First, the patient lies on their back with their feet in stirrups. Next, the physician examines the outside of the vaginal area. Then they insert a speculum into the vagina, which separates the vaginal walls. The physician is then able to examine the cervix. And next, the physician inserts 2 fingers into the vagina to check the uterus and the ovaries. So the purposes of the pelvic exam are to evaluate for pain, bleeding, and vaginal discharge, as well as screen for cervical cancer, breast cancer, and sexually transmitted infections. The gynecologist attempts to make the pelvic exam a positive experience. However, many factors of the procedure can make patients feel quite uncomfortable. There are both psychological and physical stressors that stem from the pelvic exam. Psychologically, patients can experience qualms about vaginal odor, worries about cleanliness, embarrassment about undressing, concern that the gynecologist might discover something about sexual practices, fear of pain, and fear of discovery of a pathological condition. Physically, when anxious, the pelvic floor muscles actually contract and tighten, which can then lead to more pain during the exam, specifically during the insertion of the speculum. Additionally, the exam is performed in the lithotomy position, where patients can feel extremely vulnerable. In the lithotomy position, the patient's legs are flexed, separated, and supported in stirrups. Ultimately, this position involves the exposure of intimate parts of the body in a vulnerable situation with loss of control. So my goal for this project is to redesign the gown to give women a sense of control and inspire them to properly take care of their bodies. So who am I designing for and with? I went to Reddit and I asked, what is the worst part about visiting the gynecologist besides the speculum? Within 24 hours, I got over 100 comments. Comments ranged from feeling like you have no sense of body autonomy to feeling like a stranger is looking at your body to, and I quote, being a woman at the gyno is like being an animal at the vet. So from that information, I move on to my user, looking at women ages 16 and up who experience anxiety and discomfort during a pelvic exam or while at the gynecologist, as well as before or while making an appointment to see the gynecologist. Also just feels a sense of a lack of control at the gynecologist. So moving on to my design opportunities, I began to look at stress relief and how I could create a product that could be used before, during, and after visiting the gynecologist for a pelvic exam. However, I felt that this concept would not reach a wide enough audience, and there are opportunities to make changes within the current system. So this leads to my updated concept, which is the provided gown used at the gynecologist. The gown opens in the front, and it's made of a thin paper or cloth, and you're given a paper blanket, which is really more like a napkin to drape across the lap. And this is all presented usually like this, which is just placed on the exam table. Going back to my research that I did on Reddit, I found a lot of comments made about this saying that it's really not helping with relaxation, it's never warm enough, it's just really uncomfortable to sit there naked in a paper robe. So moving on to my ideation process, I looked at existing gynecological examination gowns to see what worked and what didn't. I wanted to determine my constraints for design, but also look at what I think is uncomfortable and what could allow for a more comfortable examination gown. So this then led to my initial sketches where I continued to look at existing gowns, but also tried to ideate and come up with different designs that would be more comfortable and more effective for the physician as well as for the patient. So beginning to create mock-ups, I looked at this sketch, which has a crew neck design and an opening only on the top with a cinched waist using elastic or an adjustable tie. For my next mock-up, I looked at this kimono-style gown with crisscross breast panels and Velcro attachments to allow the physician or the patient to undo the breast panels. For my third mock-up, I looked at this design that has Velcro attachments and breast panels similar to the previous, but also has under breast support to not only provide a sense of security, but also to provide support for those with larger breasts. So after creating my mock-ups, I spoke with Dr. David M. Jaspin of Einstein Healthcare Network, and he gave me some great insight, which I summarized here. So firstly, the gown is not one size fits all. Second, for his comfort as the physician, he depersonalizes the patient during the examination, meaning he only exposes isolated parts of the body. Next, we spoke about how the gown is just one more thing patients don't have control over, and this happens time and time again after they visit the gynecologist. The excess fabric that comes with patients wearing the gown with the opening in the back can be quite cumbersome during the examination, and anxiety during a pelvic examination is an age-independent issue. So after this interview, I looked at design precedents, including the nursing bra, examination skirts used in Korea, split crotch pants that are found on toddlers in China, and spa robes that can be soft and tightened to provide comfort. Then I went back to sketching with these precedents in mind and thought, what if people can pick their own gowns? What if women could pick a cinched top or pants or a full gown or just a skirt, just providing more control for these patients. So not only would I like to update the material the gown is made of, but I'd also like to update the way it looks in terms of pattern and color. So just gathering inspiration from Catherine Plum of KJP Studio and looking into her work and possibly collaborating with her to update these gowns. So for my next steps, I'd like to create updated mock-ups using found materials such as robes and pants and test on users, and then make changes based on user testing and begin making samples to test again, and then begin looking at materials. Thank you. I'd love to hear your feedback.